So we're drawn to an enjoyment of working with people and trying to help people. I think that's what draws us all to the field. Once you get there, you realize how diverse a field it is, and you can find pockets of what really gets you excited. And for me, it was cardiology. I really like to solve problems. Cardiology is a very challenging field. There's a lot of different ways to look at the heart. And I always found putting that puzzle together to find the right diagnosis was the most interesting part of cardiology. I like to be the detective and figure out what your issue is. You can't get the right treatment if you don't have a doctor that can get the right diagnosis. I see both patients in clinic, I'll spend time in the hospital, and then the other days I read a variety of different types of cardiovascular imaging. It's more than just figuring out what the issue is, it's getting a sense of what each patient's goals are for their care. It really gives you a chance to sit down and talk and get to know somebody. And then it gives us a good chance for people to ask questions, come up with a plan, come up with contingencies of that plan. We do it for the people. To see somebody either be not feeling well or suffering and then get them the right treatment and then see them feel better and have better quality of life, that's why we do it. When people are suffering and you can find them the treatment to make them feel better, that's the most rewarding part. To have them come back weeks, months later and say, I feel so much better. Alternatively, a lot of times I get a lot of satisfaction just reassuring people. You know, a lot of times people are told that things are hopeless or they're scary, you should be worried about this. And then the chance to say, look, we've seen this 1,000 times, we have a plan in place, sleep well tonight. That also can be very reassuring, is to tell people that, you know, other people have their problems and that they can live their lives pretty normally, and we'll just keep an eye on things. So it's a variety of patients, variety of problems. They all have their different needs, and just helping the person get what they need is the best part about my job.